Dementia and coronavirus. Here are some special care issues and suggestions. Welcome back. I'm Dr. Jim. Many seniors with dementia are living either at home and receiving some kind of assistance, or they reside in skilled nursing centers or assisted living communities. Keeping them safe from the new coronavirus, or as it's also called, COVID-19, may be especially challenging due to the cognitive impairment associated with dementia-related disorders like Alzheimer's disease. Dementia-related behaviors increase the risk of infection. While dementia itself does not increase the risk of COVID-19, there are a number of behaviors that can place individuals with cognitive deficits at a disadvantage concerning the illness. For instance, people with dementia may forget to wash their hands regularly throughout the day, or to use alcohol-based hand sanitizers, and they may come into contact with surfaces contaminated with COVID-19, which is now known to live on certain surfaces for hours or days. Infection and the worsening of dementia-related behaviors is also of great concern. Once a person is infected, symptoms of the virus can actually worsen cognitive impairment, which is caused by dementia or Alzheimer's and other diseases. A dry and persistent cough, high fever, shortness of breath, aches and pains can be very difficult for someone who has cognitive impairment, dementia, or Alzheimer's. These symptoms can be tough to manage without cognitive impairment. They can certainly exacerbate the problems. Any of the COVID-19 symptoms can increase confusion and agitation. So we have to deliver proper care to our seniors who have dementia. Caregivers, too, may find caring for a COVID-19 infected senior who has cognitive issues due to Alzheimer's or dementia particularly challenging to care for. If there is a sudden increase in confusion, agitation, disorientation, or other symptoms, please consult a healthcare provider if you're taking care of them at home, and do so immediately. You should demonstrate good hand hygiene. Sit down with the senior that you're taking care of and provide the individual with extra written notes, little Post-it stickers around the faucet in the kitchen, the sink in the bathroom. Give them reminders. Wash your hands for 20 seconds. Wash your hands and sing happy birthday, because that's long enough to get the germs off your hands. If you cough or sneeze in a tissue, throw it into a wastebasket immediately. Don't put it on your bedstand or a countertop or your kitchen table, because you're going to probably cross-contaminate. So demonstrate how to properly wash hands and remind them to use alcohol-based sanitizer when they can't get to a sink. Maybe on a little table where they watch TV. Keep it right there for them. And remind them to use hand sanitizer or wash their hands if they touch any surfaces between hand washings. Food and medications. These are important. For seniors living at home, call your pharmacy, request that prescriptions are filled for longer periods of time, more than 30 days. I would ask for 60 days out or 90 days out. Get as far out as you possibly can to ensure that seniors are in good stock with their meds. Check the refrigerator, check the pantries, check the cupboards, and make sure that they have enough food and snacks, supplements, bottled water, whatever, to get through a week or two out. We have to start thinking in weeks now, not days. Think ahead about appointments that are coming up that can be rescheduled. If adult daycares are closed, your backup plan. Elective surgeries that can be scheduled later. Think about all these things now. Create care schedules. This is important. Make alternative schedules for someone to be with the individual on a regular basis. Larger families like mine and the wonderful family that I married into, they can take shifts. You know, larger families have an advantage if they live around the senior, of course. They could take advantage of turning this schedule around into shifts for being with their loved one during this outbreak and as long as it takes. So every family member that takes a shift has to follow universal precautions and reduce cross-contamination. They don't want to come in and help that senior and then increase the risk for infection. Emergency information should all be out in the open where anybody can find it. Telephone numbers to the local hospital, their primary care physician, a dentist, the pharmacy, family members' numbers, close friends, telephone numbers and emails, whatever it is. So think about all of these things. And that's why I put the video together, because it's very difficult to think about all of this while some of us are dealing with a lot. My final thoughts: there are many things to think about concerning the care of an individual who is cognitively impaired while protecting them from becoming infected with coronavirus. Are dementia-related symptoms worsening because the individual is infected? That's something you have to think about. Are there specific behaviors that place your loved one at increased risk for contracting the virus? Will they wash their hands? Will they use hand sanitizer? Will you keep encouraging and repeating this over and over again? And of course, think about food, water, and medications, as well as someone being there until this outbreak passes. And like every storm that has ever hit us in history, it eventually passes. I'm Dr. Jim. Take care of those folks out there with dementia, Alzheimer's, and anyone who might be cognitively impaired. Check back regularly, because I'm doing research nonstop, and I want to keep informing you as much as I possibly can. Thank you for stopping by.